Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes a sore vagina? There are many possible reasons why you may be experiencing a sore vagina, also called vulvar pain. Some causes, like irritation or menopause, may be evident. Other causes, like a sexually transmitted infection, STI, or a cyst, are not as apparent. /r/n/r/n What people call vagina pain may involve the vagina, the inside part that connects to the womb or uterus. But it may also involve the vulva, the outer part of the genitals. When the vagina and vulva are inflamed, it's referred to as vaginitis. /r/n/r/n/Verywell, Laura Porterrnrn Vaginal pain can have many different causes. Some are serious, while others go away on their own or respond to simple treatments. /r/n/r/n A yeast infection is caused by a fungus. It can cause vaginitis, or inflammation, leading to soreness and itching around the vulva and vaginal opening. Other symptoms include /r/n/r/n Some people are more prone to yeast infections, including people who /r/n/r/n Hygiene habits can sometimes raise your risk, for example, not quickly changing out of sweaty workout clothes. /r/n/r/n Bacterial vaginosis, BV, is an infection that happens when too much bacteria grows in your vagina. /r/n/r/n Not everyone has symptoms, but if you do, you might notice, /r/n/r/n Your risk of getting BV is higher if you, /r/n/r/n Sexually transmitted infections, STIs, can also cause vaginal/vulvar pain and many other symptoms depending on the specific STI. Vaginal symptoms may include /r/n/r/n Some examples of STIs include /r/n/r/n If you think you could have an STI, talk to your healthcare provider. You and your partner should be tested to reduce the risk of passing it on or having complications. /r/n/r/n Urinary tract infections, UTIs, are prevalent, especially in women. It is estimated that 50% to 60% of women will have one or more UTIs during their lifetime. /r/n/r/n UTIs happen when bacteria enter the urinary tract. Symptoms include /r/n/r/n A UTI can make it painful to have sex. /r/n/r/n Vaginal irritation and allergies can cause soreness. The irritation or allergy may be a reaction to /r/n/r/n Shaving or waxing the area can also cause discomfort, especially when the hair grows back. This pain is usually temporary. /r/n/r/n Vulvodynia is vulvar pain with no identifiable cause and has been present for at least 3 months. Pain may be felt over the entire vulva or only in one area and may cause different types of symptoms, such as /r/n/r/n Symptoms of vulvodynia may be constant, or they may come and go. Symptoms can start and stop without warning, or they may occur only when the area is touched. /r/n/r/n Genetics, hormones, pelvic floor conditions, nerve irritation or damage, or trauma may raise your risk. Vulvodynia can also happen after medical procedures such as chemotherapy or surgery involving the nerve upperly in the area. /r/n/r/n Vulvar vestibulitis, also known as vestibulodynia, is pain in the vulvar vestibule. This is the area of the vulva between the labia minora and encompasses the clitoris, urethral opening, and vaginal opening. Like vulvodynia, a diagnosis comes with pain that lasts longer than 3 months. It can cause symptoms like /r/n/r/n Researchers need to learn more about the causes of vestibulodynia. However, some causes include the human papillomavirus, HPV, frequent yeast infections, and recurrent bacterial vaginosis. Some neurological conditions that cause the brain to confuse normal sensations like touch, stretching, or pleasure, as pain may also be involved in vestibulodynia. /r/n/r/n Bartholin glands are responsible for lubricating the vagina. A Bartholin cyst occurs when the Bartholin glands on the labiath skin folds around the vaginal opening become blocked. /r/n/r/n A cyst that's not infected may show up as a painless lump. These often resolve on their own. /r/n/r/n If a Bartholin cyst becomes infected, it might swell up, be painful, and make walking or sitting harder. This may require treatment. /r/n/r/n Endometriosis occurs when the lining or tissue of the uterus, womb, builds up outside the uterus. Not everyone has the same symptoms, but some common symptoms of endometriosis include /r/n/r/n Pelvic floor dysfunction is a health condition where the muscles and tendons in your pelvic area weaken. It can cause vaginal pain, especially during sex. /r/n/r/n You may leak urine or have trouble controlling bowel movements if you have pelvic floor dysfunction. These issues can be caused by /r/n/r/n Vaginal pain can occur because of hormonal changes during menopause. The vagina may become drier. Vaginal tissue can become thin and tear more easily. These changes can make sex painful. /r/n/r/n Other symptoms may include /r/n/r/n There is also an increased risk of infection, which can lead to vaginal pain. /r/n/r/n Lichen sclerosis can occur at any age but is most common in postmenopausal women. It is a rare skin condition that causes itchy and painful patches of thin, white, wrinkled-looking skin on the vulva and/or anus. /r/n/r/n Lichen sclerosis is a chronic condition, and currently, the cause is unknown. /r/n/r/n The tissue in and around the vagina can tear or bruise during rough sex, leading to soreness. Sex can also lead to chafing around the vulva. /r/n/r/n These symptoms are more likely if the skin is thin, dry, scarred, or affected by a health condition such as eczema or psoriasis, although all vaginal skin is delicate. /r/n/r/n If you think you may have an injury inside your vagina, seek medical care. In rare cases, internal bleeding can be life-threatening. /r/n/r/n If you have been sexually assaulted, reach out for help as soon as you are safe. One way to get help is to call the National Sexual Assault (RAIN) hotline at 800-656-HOPE, 4673. You can also speak to a healthcare professional. /r/n/r/n Vaginismus is a condition where vaginal muscle spasm. It can make it difficult to have sex. It can also cause pain. /r/n/r/n People may develop vaginismus in response to trauma. It can happen because you're nervous about having sex. But it can also occur during menopause or after childbirth. /r/n/r/n If you've just had a baby, your vagina will be sore for a period of weeks afterward. Sometimes, pain from childbirth lasts even longer. /r/n/r/n Injuries from straddle accidents, vehicle accidents, sexual assault, and female genital cutting can also cause long-term pain. /r/n/r/n See a healthcare provider if your symptoms bother you and don't go away. If you have urinary symptoms, it might be best to see a primary care provider, urgent care provider, or urologist. If your only symptom is vaginal pain, you may want to see a primary care provider, an urgent care provider, or a gynecologist. /r/n/r/n It's especially important to seek medical care if you have vaginal pain or soreness and are pregnant, in menopause, or have a new sex partner. If you're pregnant, seeing an obstetrician or gynecologist may be best. /r/n/r/n Seek immediate medical attention if you have been sexually assaulted. Do not clean yourself or change your clothes ahead of your visit. /r/n/r/n These are other signs that you need to see a doctor, /r/n/r/n if you have severe pain, bleeding, and/or a fever, you may need to visit the emergency room, ER. /r/n/r/n Some healthcare providers may minimize women's concerns about pain. Studies show that women of color, trans, and LGBTQ people often feel their healthcare providers don't get them and their pain. The same is true for women with low incomes, chronic pain, or disabilities. /r/n/r/n When you're seeking care for vaginal pain, or anything else, you need a healthcare provider who takes your symptoms seriously. If you don't feel heard and respected, look for another provider. /r/n/r/n It can take time to find out precisely what is behind your pain. You may be able to confirm some causes with an at-home test, others require a medical evaluation. /r/n/r/n To identify the cause, a healthcare professional may /r/n/r/n Tests that detect some causes of vaginal pain are available online and in many drugstores. /r/n/r/n There are tests for /r/n/r/n Some give immediate results, while others may need to be sent to a lab for analysis. /r/n/r/n Self-tests that check for allergies and sensitivities exist, but they may not be as reliable as tests performed by a lab or healthcare professional. /r/n/r/n When you visit a healthcare provider, you may need /r/n/r/n In some cases, imaging is the best way to find what's causing your vaginal pain. For example, a transvaginal ultrasound can show endometriosis. /r/n/r/n Endometriosis can also appear on a magnetic resonance imaging (MRI) test, a computerized tomography (CT) scan, or a laparoscopy surgery in which a tiny camera on a long tube takes pictures inside your body. /r/n/r/n Imaging tests can also detect pelvic floor problems and internal injuries. /r/n/r/n Treatment will depend on the exact cause of your soreness or pain. In some cases, changing your routines may be all that is needed. In others, medical intervention may be necessary. /r/n/r/n Vaginal pain may decrease if you make some simple changes. For example, it may help to /r/n/r/n Conditions like STIs need to be treated with medications. They won't go away on their own and can cause serious health consequences if left untreated. /r/n/r/n In some cases, medication can resolve or cure pain. Antibiotics or antifungals for infections are a good example. If the pain is from a long-term condition, a healthcare provider can help you manage symptoms with medications, including /r/n/r/n Your therapist may work with you to build your pelvic floor muscles. /r/n/r/n Some people learn to relax vaginal muscles using dilators, which are tapered wand-like tools that come in various sizes. /r/n/r/n Cognitive behavioral therapy can teach you strategies to relax tense muscles or cope with anxiety, trauma, or pain. /r/n/r/n If the pain does not go away with other treatments, you may need surgery. For example, if you have an infected Bartholin's cyst, it may need to be drained. /r/n/r/n In some cases, surgery to remove scar tissue helps with endometriosis symptoms. A hysterectomy removal of the uterus is another option for endometriosis. /r/n/r/n To protect your vulva and vagina, you can /r/n/r/n Pain in or around your vagina can have many possible causes. Infection, injury, health conditions, menopause, childbirth, pelvic floor problems, and allergies can all make the vulva or vagina sore. /r/n/r/n Most of the time, vaginal pain will go away on its own or with self-care. But some types can be severe. Medication, physical therapy, and even surgery may be needed to restore your health. /r/n/r/n. While there is nothing wrong with trying home remedies or over-the-counter treatment for certain mild vaginal symptoms, I recommend being evaluated by a healthcare provider, especially if symptoms are moderate or persisting. There is a wide range of issues that can cause vulvar/vaginal soreness, and each has a different treatment. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.